when something is in the periphery, is it first, second, or third order? First order, right? First order is from the dermatome, right? Whatever you're perceiving the information, all the way to your spinal cord. Second order is from the spinal cord all the way to your brain. Third order is within the brain. This is for the sensory. Now, what is the example of it? We're going to be talking about what? Herpes zoster or shingles. And this is actually a dermatome that you can see here. Okay? So this dermatome that you see here, and this is caused by a varicella zoster. Okay? Normally, have you ever had shingles in your life? Herpes zoster? No? So let's talk about herpes. Herpes, you have two types of herpes, right? Type 1 or what are the types? Herpes type 1 or type 2. Type 1 most likely is found where? In your mouth. And there's a nice rule. So herpes type 1 is actually from the head all the way to the belly button. From the belly button below is herpes type 2, which is the sexual herpes, right? But think about it. If you are in a relationship and, if you are in a relationship, you can either have type 1 or type 2. Now, do you know that you have herpes type 1 or type 2? Well, you don't know. Because that only comes one in a lifetime in your life whenever your immune system is depressed. So whenever you're really stressed out, you have this. So you guys ever heard of cold sores? So cold sores are the type of herpes type 1. So most likely you're going to live your rest of your life with herpes type 1. But your herpes will not be stimulated or not be shown any effects on your body until you're really stressed. Okay? So, if you kiss another person, then most likely you're giving what? Herpes type 1 mouth to mouth, correct? Whenever it's active. Right? Inactive is really hard to do it. If you have sexual herpes, right? If it's inactivated, because you have it, but it's not giving you the physical effects, then it's really hard to pass it over, but you could. So, if you do fellatio or cunnilingus in somebody who has herpes type 2, now you have herpes type 2 in your mouth. Okay? So this can be passed over. If by any chance you have either one or the two herpes, right? Type 1 or type 2, later on in life, in your adulthood, you can have herpes zoster. And what is herpes zoster? It's actually a painful burning rash. So almost all of us will had or had a rash before, correct? A rash is normal. Some of the rash may be itchy, others may be a little painful, but not in the form that this gives you to you, right? In a dermatome, right? That's the dermatome. So, and it's not always showing you on the abdominal cavity. It can actually be shown on the arm. So, but if the rash is painful and burning, like burning is like you feel like something is burning in your skin, and on top of it you have blisters, okay? That tells you automatically that's herpes zoster. And that is actually affecting the dorsal root ganglion. What does the dorsal root ganglion carry? Sensory or motor? Sensory. And that's why you feel that painful burning rash. Okay? Everybody got that? Okay. Nowadays, if you see a young individual with herpes zoster, just like this one, you gotta think of something. One thing is that that person is immunocompromised or immunodepressed, right? So what is immunosuppression, right? Or depression? Immunosuppression is when you have a chronic disease, right? Or you're taking medications that are suppressing your immune system. Or you have young individual, HIV. So the first thing you have to disclose is that that person would not have HIV. Because it's not common for a young individual to have a herpes zoster. That's in elderly. Okay? What are some of the abnormal developments of the central nervous system? So, central nervous system, brain and spinal cord. Your spinal cord can have different ways of malformations. Like, for example, what? Anencephaly. Anencephaly means what? No brain. Okay? You can have a newborn that has no brain. You can have something known as cranial archischisis, right? Which is basically opening of the back of the cranium as well as the top of the spinal cord. You can have open spinal bifida. You can have anencephaly, okay? You can have encephalocele, which is within your encephalus, within your brain matter, you have a feeling of a cavity with CSF, and you can have a closed spinal bifida. So let's talk about this one. So a spinal bifida occulta, what is it? Spinal bifida occulta is that the actual neural tube was not properly closed, and you have a tuft of hair on top of it. So towards the sacral portion, you have this kid with a bunch of hair only on that portion, the back portion, right? Nothing comes up. It's just a tuft of hair. You have a meningocele. A meningocele is, again, that neural tube expanded, and now that neural tube contains what? A lot of CSF, cerebrospinal fluid, and creates kind of like a cyst on the back, okay, towards the sacral region. And then the other one you have is myelomeningocele, right? In the myelomeningocele is the same thing. It looks like a big cyst, but in there you have to be careful because this one contains what? Segments of the spinal cord plus your CSF. All these can be surgically treated. Okay, all of these. All these can be surgically treated. Let's talk a little bit about your cranial nerves. So central nervous system, again, brain and spinal cord. What is the mnemonic for your cranial nerves? The mnemonic is O, to touch and feel. Very good, velvet, heaven. Okay? So, O is for what? Olfactory. The first O is olfactory. The second O is what? Optic nerve. The third O is oculomotor. 2 is what? Trochlear. N is what? Nothing. Feel is what? Say 2, touch. Touch is trigeminal. A is for adducent. Feel is for what? Facial. Very vestibulocochlear. Right? The next one is good is glossopharyngeal. B for what? Vagus nerve. A is for accessory. And H, which is not here, is known as hypoglossals. Okay? So those are your cranial nerves. You need to know those. You need to know those. So let's go over those cranial nerves, right? So, olfactory nerve, what is that one for? Olfaction, smell. Optic nerve is for what? To see. That's pure sensory. Oculomotor, it tells you that you're doing what with the motor? Moving your eyes. Trochlear nerve, this has to do with movement of the eye. Okay? Trigeminal, this has 3. This cranial nerve number 5. And if you look at it, it's 3. So if you put your hand, you get 3 fingers and you put it above your hand, you see that the top finger is going to go to your eye, the middle finger is going to go to your maxilla, and the bottom finger is going to go to your mandible. Do it. Okay? Or just do this. So one is ophthalmic, the one that goes to the eye. The one for the maxilla is going to be maxillary, and the one from the mandible is going to be mandibular. Right? So that's the trigeminal, that's cranial nerve number 5. So anything that has to do with your mouth and around your mouth is 5. Anything that has to do with your ear or around your ear, right, for sensory is going to be what? 5. Okay? Then we're going to have abducent. This one is for AB induction of your eyes. So let's see what the eyes are. Let me group these ones for you. So for the eye, you have abducent, you have trochlear, you have oculomotor, right? So all these is for what? Motor command of your eye. So we got 3, 4, and 6. Everybody got that? Now, the next one that we have is facial nerve. Facial nerve is facial nerve is a little both in your face. So most of your overall face sensation is by facial nerve. All main periphery muscles of your facial expressions, right? All those movements that you do with your face, that's going to come from the 7 as well. So 7 is both sensory and motor. We also have vestibulocochlear nerve. This is vestibule and cochlea. So this is actually for hearing. Glossopharyngeal. Glossopharyngeal is your glossus. Anything that has the word glossus comes from what? Your tongue. So this is the glossus and the pharynx. This is number 9. It allows you to perceive part of the taste and part of initiation of swallowing. We have vagus nerve. Vagus nerve is the main one for breathing and mediates all parasympathetic motor commands. This is all throughout the PowerPoint. Accessory nerve, right, and hypoglossal. Okay. Now, all these nerves, they come from where? These are from the cranium. Means they come out of your brain. There's other ones that come out of your what? Spine. So we're going to focus on the spines now. I just went over those really quick. But the spine ones are what? Cervical plexus comes from where? Cervical. Right? Brachial plexus comes from what? The part that doesn't give you irrigation to your arm, right? So that's nerve. Thoracic nerve from your thoracic vertebrae, right? Lumbar from the lumbar region, sacral from the sacral region. And we're going to go into those spinal nerve, okay? So what are those? For the cervical plexus, what are the nerves that we're talking about? We're talking about C1 all the way to what? C5. What comes out of those? What is the most important thing that comes out of those? Well, you have something here known as the what? Phrenic nerve. Why the phrenic nerve? Because the phrenic nerve is the one that controls your what? Your diaphragm. If you don't have control of your diaphragm, what's going to happen to your breathing? Can you breathe? You cannot. You will die. So if you have any lesion on the cervical plexus and you damage by any chance your phrenic nerve, what happens to you? You can have a paralysis of your diaphragm and most likely you will die. Does that make sense? Because you will be unable to send motor output to your diaphragm so you can contract and relax to do the breathing. The next one that we have is brachial plexus. So what are we seeing on the brachial plexus? Brachial plexus is from C5 all the way to T1. It's actually C4B, right? But whatever. So C5 to T1. Brachial plexus means of your brachium. What is your brachium? Your arm, right? So out of that brachial plexus, you have 3 trunks. Superior, middle, and inferior. So imagine that your arm has 3 parts, right? So superior, middle, and anterior. What are they going to do? Well, of those, you're going to have a musculocutaneous nerve. If you think about it, where's the musculocutaneous nerve is going to get information from? Your muscles and your skin, right? Muscle, cutaneous, skin. Median nerve. What is your median nerve? And let's talk about those in a little more detail. So out of the brachial plexus, you have your median, radial, ulnar nerve, okay, and your musculocutaneous nerve, and your axillary nerve. So the axillary nerve is in your axilla. If you're wearing or if you're using crutches, or you sleep with your hand hanging out outside your bed, you can actually end up compressing the blood flow to that nerve, and you can have an axillary nerve compression, which leads to tingling or numbness or the level of your deltoid, teres minor, and the skin on the shoulders. I don't know if you ever felt that before. Now, on the other hand, you have your radial nerve. The radial nerve, if you think about it, is just the same anatomy, right? It goes all the way to your radius. So it goes on the triceps, to the back of the arm, all the way to your radial bone. So that's the radial nerve. The ulnar nerve is the innermost, is the one that is more medially located. And the ulnar nerve pretty much innervates the middle aspects of your brachium and antebrachium. The median nerve is in the middle of the two of them, right? So that's in between both of them. So this is what innervates your palm of your hand. So here's your median nerve, right? Right here. Okay, that's your median nerve. Let's talk a little bit about this one. So these are just parts of the hand. If you have the first, second, third digit, what's going to happen? Well, those are dictated by whom? By the median nerve, right? If you have damage of the number 5th and number 4, that's damage of what? Ulnar nerve. And if you have damage of the radial nerve, that's on the back of the hand, right? So what do those look like in real life? A median nerve, this is actually known as median neuropathy, right? And again, the median nerve is the palm of your hand, correct? Or some of the part of your hand. This is known as the ape hand, okay? You're gonna have an ape hand. On the other one is you have ulnar neuropathy. And if you look at it, this is the ulnar, right? The 4th and the 5th digits, right? Same as the palm of your hand. That one is going to give you a what? Pope's blessing or benediction sign. What does that mean? When the Pope does it, the Pope does this to you, right? Look, what are they working? 1, 2, and 3. What is damage? 5 and 4. Everybody got it? And then this is your number 5, and this is your number 4. Does that make sense? So you won't be able to move this ones. Okay, that's why they call it the Pope's blessing. And then finally we have a radial neuropathy. And the radial neuropathy, that one is you're gonna have a wrist drop. It means you won't be able to move your wrist. So if you see anybody walking with a wrist drop like this, then most likely they can have a radial neuropathy. Now, what is carpal tunnel syndrome? Have you ever had carpal tunnel syndrome before? Yes, you have. Probably you have. So if you use a keyboard or a mouse for a long period of time, right, what happens? The actual position of the hand, hyperextension of your hands, right, so you have flexion, extension, and hyperextension of the wrist. When you do that, then that compresses that median nerve. And when you compress the median nerve, you're going to have a, what is the most common compression of the median nerve that passes over the flexor retinaculum, and that gives you a carpal tunnel syndrome, which is tingling sensation of most of the fingers in your hand. Especially what? Number 1 through number 3. Have you ever had any tingling sensation or numbness of these 3 fingers? That's the median nerve. Right? So if you use those. Now the lumbar plexus, this one, what are the main ones that comes from it? So lumbar plexus is from T12 to L5, and you have your genital femoral. What is that going to? Genital femoral. It goes to your genital area and to your femur. The other one that we have is lateral femoral cutaneous. It goes to the femur, right? But not genital, it goes laterally on the outside part. And then mainly what we have is these are the main ones. You have your femoral nerve. This is pure femur, right? So this is the anterior muscle of your thigh, which is your quadriceps femoris. And you have your obturator nerve, which is the one that allows you to obturate, right? Close your legs. And then we have your sacral plexus. So the sacral plexus is from L4 to S4. Now, the sacral plexus mostly gives you what? Superior gluteal nerve, inferior gluteal nerve, superior gluteal and inferior gluteal, right? Just parts of the glutes, right? From the gluteus maximus, medius, all the way to minimus. That's what superior gluteus do. If you don't have a superior gluteal or inferior gluteal, most likely you will be unable to contract your buttocks, right? Now, if you cannot contract your buttocks, most likely what's going to happen? You won't be able to sit or walk upstairs, because that's what they work for, right? Most likely. When you're working your buttocks, right? What do? Squatting, right? And when you do squatting, whenever you go down or up, you feel what? That in your gluteus maximus, right? And medius. So that's what you're working on. The next one that we have is the thickest nerve of your whole body, and that is known as the sciatic nerve. Okay? The sciatic nerve is posterior muscle of the thigh. So sciatica is the relationship to this one, and sciatica is a sharp pain sensation on the middle of the butt all the way in that radiates to the back of your leg all the way to your calcaneus. If you ever had that pain before, that's a compression of your sciatic nerve. That's called sciatica. Okay? It's kind of like it's a stabbing pain. So it affects the semimembranous, semitendinous, and adductor magnus. And then finally we have your pudendal nerve. Pudendal means what? Pubis. Right? So that's the sensation of the area of your pubis. So here you can see the sciatic nerve that goes all the way back, right? Goes all the way at the level of the knee. At the level of the knee, this we call it your tibial branch, and you have that into a common fibular nerve, which is, of course, the sciatic nerve splits into two main branches, okay, at the back of the knee, at the level of the popliteal fossa or popliteal triangle. The next one that we're going to do is we're going to talk about the somatic and visceral reflexes. What is somatic? Body. And visceral? The internal organs of the body, right? So somatic is the outside, visceral reflexes is the internal organs. So you want to have reflexes around your body, right? Both of the outside and both of the inside. So what is type of circuitry they use? Remember, all we're talking about is a single cables, right? And cables can have multiple connections. So what is the actual pattern of a neural circuitry? So what does that pattern look like? Well, we can have something known as divergent. Means whenever you perceive a sensation from one neuron, it diverts into what? Two more, right? 1 and 2. Everybody got that? So this is a spreading the stimuli to multiple neuron pools. Convergence, what does that mean? Converging means it's coming into one. So you can have multiple areas picking up pain, temperature, or proprioception, right? Converting into one single neuron that sends the information all the way into the brain, right? So you have neuron 1, neuron 2, neuron 3, and neuron 4 into a single neuron that takes the impulse all the way out. So that is a input into a single neuron from a multiple source. The next one is going to be serial processing. And a series is just one-to-one, right? That's what a series is. Then we have your parallel processing. Parallel is when things are next to each other. So a parallel, if you have, is you have two parallels that splits into more. So it's actually pretty much a divergent into parallel circuitry. You see it? So, but this is actually called parallel. That means you have these pools process the information at the same what? Time. So you can send a lot of impulses at the same time, so you don't lose time. Instead of sending an impulse now, and then 2 milliseconds after, and 2 milliseconds after, because you only have one neuron, this means you have multiple of them at the same time. So think about it. When you close your hands, how many neurons do you send at the same time? A lot, but at least what? 1, 2, 3, 4, and 5 at once, correct? When you perceive sensation in each one of your fingers. And you perceive what? Pain, touch, temperature, vibration, proprioception, and all these from each part of your finger. So that's a lot of what? Parallel processing. And finally, we have the reverberation. What does that mean? This actually works as a positive feedback. What does that mean? Every time you step in the floor, you feel what? Pressure in your foot as your body goes on top of the foot against the floor. Every time you put your hand on top of something, you perceive the temperature and the shape of the object, correct? That is a feedback saying, okay, you perceive this into your brain. whenever you're moving your hand and you want to pick up a pencil, okay, you lift it up based on the first time instance of lifting the pencil, right? So you have feedback saying how much does that pencil weigh, what does it look like, and how can you move it? Because if you have objects on the side, that will automatically readjust the movement of the pencil. Does that make sense? So that works through a positive feedback. So this is known as a reverberation. Normally, we have homeostasis, right? Homeostasis is kept in your body at check by what? Positive feedback and negative feedback. This is the positive feedback. Okay?